So basically, hydatid disease is a zoonotic disease, as you already know, that it is caused by Echinococcus granulosus or Echinococcus multilocularis. This disease is quite common worldwide and endemic in our country. How do we contract this disease? Basically, we contract this disease from the dogs. So basically I'm talking about Echinococcus granulosus, because we contract this disease from dogs, while Echinococcus multilocularis, that is from the fox. Okay, so inshallah we'll talk about later about the Echinococcus multilocularis. So basically we contract it from the dogs because the dog is a definitive host. Although sheep are the usual intermediate host, but humans are basically accidental intermediate host. That's why humans are an and stage to the parasite. That means that we do not transmit this disease to other species. Okay, so at this point in time I want you people to recall about the definitive and the intermediate host. So basically, definitive host is also called as the primary host. It is an organism in which parasite reaches maturity and reproduces sexually, while intermediate host, which is also called as the secondary host, it is that which harbors the sexually immature parasite, and it is required by the parasite to undergo development and complete its life cycle. Okay, so when the parasite reaches duodenum, the parasite hooklets penetrate the mucosa. I will just show you here. These are the hooklets. You can see here. These are the hooklets through which it actually penetrates the duodenal mucosa, and because of that, now it can just go into the bloodstream and can infect any organ. Okay, so we will just discuss about the structure of the hydatid cyst. So basically, visible hydatid cyst takes approximately 3 weeks to develop after ingestion. And here I will just show you this part. You can just focus here, the outer side, okay, which is written here as adventitia. Adventitia is basically pericyst. Pericyst means that it is actually the compressed liver tissue. So this is basically the host tissue that is compressed because of the pressure of this cyst. Okay, this is not actually the part of the hydatid cyst. So these two membranes, as you can see here inside, the one is this laminated one, okay, and the other one, which one, this one, it is called as the germinal layer. So these two are basically the layers of the hydatid cyst. This laminated membrane, this is called as ectocyst, while this inside, which is germinal layer, this is called as endocyst. Okay, and here you can see these are the daughter cyst. Germinal epithelium, endocyst, this one is actually a single layer of cells. You can see here, this is single layer of cells lining the inner aspect of the cyst, and it remember that it is the only living component which is responsible for the formation of other layers as well as the hydatid fluid and brood capsules of the cyst. You can see here, these are the brood capsules, these bud from this germinal layer. So basically this is the living layer. Okay, and now what are the brood capsules? Brood capsules are basically small intracystic cellular masses. You can see here, these are the intracystic cellular masses in which future form heads develop into scoliosis. ये देखें, इसके अंदर develop होते हैं scoliosis. अब क्या होता है? Remember that in a definitive host, the scoliosis they develop into an adult tapeworm, while in intermediate host like us human, it can differentiate only into a new hydatid cyst. So basically these hydatid cysts, which are daughter cysts, these are developed from this one, while in dogs it will change into adult tapeworm. Okay, so now about the pathology. So Echinococcus granulosus, as you know that this is a recognized as having potential to infest any body cavity, any organ or any tissue. But remember that in adults, liver is the most commonly affected organ and lung is the second most common one, while in pediatric population this is reverse. Lung is the most common organ affected in children and liver is the second most common. Okay. Now what about the cystic echinococosis? This is actually the most common one. Inshallah we'll be discussing about that cystic echinococosis in detail, because this is the most common one. While the alveolar echinococosis is basically just like this. Here you can see, although this is liver, but here if you see, it seems like alveoli, because these are small cysts. Okay, you can see here, and remember that this is quite fatal, and fortunately it's not very common. Now about the sign and symptoms. Remember that the clinical presentation is largely asymptomatic until complications occur or it merely becomes large enough. Okay, so it may cause its symptom because of the mass effect or because of the complication. Otherwise, usually it is silent. Okay, the most common presenting symptoms are abdominal pain, dyspepsia and vomiting, while the most frequent signs are hepatomegaly, jaundice and fever. Bacterial superinfection of hydatid cyst can occur, and it will present just like pyogenic abscess, as we have discussed earlier. And rupture of the cyst into the biliary tree or bronchial tree, or free rupture into the peritoneal, pleural or pericardial cavity can occur. Okay, so free rupture, basically that may result into disseminated echinococosis, or there may be fatal anaphylactic reaction. Okay, a recurrence is quite common. This is the most common complication of the hydatid cyst. You can see here that this is basically the hydatid cyst of the liver, but that has ruptured into the lung. Okay, and this fistula you can see through the diaphragm, it has gone into the lung. And here you can see, basically here this is an x-ray of an old lady who presented to the emergency department with history of hemoptysis and chest pain and dyspnea. She also had a chronic cough with thick yellowish sputum, which was associated with the low grade fever and mild weight loss over the past few weeks. So a plain x-ray chest was taken, and here you can see there is a mass in the lung. Okay, and here diaphragm is okay, it's not elevated on both sides, it's okay. So basically you can see there is whitish patch. This one is okay and this side is okay. So in order to obtain more clear details of the disease process, MRI of the thorax and liver was ordered. And here you can see in the lung, actually there was some complicated mass, and in the liver also there was a mass. And here you can see this is the diaphragm, but now here you cannot see the diaphragm. This is basically the communication between the hydatid cyst here in the liver with that of the hydatid cyst in the lung. So this is actually called as hydatid pulmonary fistula. Here this is actually the MRI, CT scan, and here in the CT scan you can see this is the diaphragm and this is the cyst in the liver, and here you can see this cyst into the pulmonary cavity. and in this CT scan you can see actually every organ is infected. Every organ is infected with the hydatid cyst. This is basically MRI, and in this you can see this hydatid cyst which is communicating with the left main hepatic duct. This one, there is communication. You can see this is the hepatic duct and this is the hydatid cyst in the liver, and there is a communication. Such patients usually present with obstructive jaundice or even cholangitis. You might know cholangitis. Cholangitis, it is the infection when there is obstruction of the CBT. So patient presents with the jaundice, high grade fever with chills and rigors, okay, and severe right hypochondrial pain.